is Becky Brown. I am from Carlson, Virginia, where I currently live, and I am a patient of Dr. Carlson's and have been for probably the last 10 years. And he has done two of my my spinal fusions. He did my cervical fusion probably about 6 years ago. And most recently in February of this year, 2017, he did my lumbar fusion, L2 through 4, with great success, I'm happy to say. I work full time, so my work week, I would work all day and I would come home and lay on ice and go to sleep for the rest of the night. It was very depressing. I gained weight. I obviously couldn't do any of the activities that I wanted to do before. It got to where I couldn't even do yoga, simple basic stretches anymore. My younger son was playing high school football, and even just getting through that fall period of sitting on the bleacher and watching him, that was important to me. Many games I spent standing. It was very, very uncomfortable, so it was quite limiting, especially for somebody being so active. So I am an employee health and wellness coordinator in one of the Hampton Roads cities, and part of my job is obviously teaching health education and being physically active and people seeing that. So it was really hard from that perspective of me, because I couldn't teach classes. I felt, like I was one of them sitting in some of the audiences sometimes with our classes. But it was really hard too, because I'm also a personal trainer. I've always been physically active. It's actually what got me here. Years ago, I was a competitive cheerleader, so I had a lot of injuries along with a family history of osteoarthritis of the spine and degenerative disc disease. And so it really put me under, especially with the lumbar, because it got to the point where it was very uncomfortable to sit, very uncomfortable to stand. I got to the point where I couldn't even walk on a treadmill at 3 miles per hour without crying. And for me to be going from CrossFit, TRX, and everything else I did, and then training people also, I couldn't do anything, even had to stop yoga. So I was pleasantly surprised. After the treatments, Dr. Carlson, we knew I was going to have surgery eventually for sure. I also had scoliosis too. And he said, "You'll tell me when you're ready." And so I went through physical therapy and the injections, the epidural, and we got to the point where, it became too much for me. So going in, I had all the typical symptoms for that area, the sciatica, the groin pain, the leg pain, the back pain, of course. But immediately, just as I did with my neck fusion that Dr. C did, I felt relief. I could feel my leg again. I didn't have that burning pain. Of course, I was coming out of anesthesia, but I just knew that it had worked. I could move my leg. It just felt completely different. The rehabilitation process was a little harder than I thought it would be, honestly. For me, being in good shape originally, it was hard work. In order to succeed after the doctor does their work, you have to do your work. And when I look at patients I've treated in the past as a trainer, or coworkers that I deal with now with health education, not everybody's willing to do that, and they just expect a miracle and then they're done, and it's not that way. You really, I was shocked how long it took me to get my flexibility and everything back, but I worked hard at it, ate right, lost more weight, things like that, and that certainly has helped to come to where I am now. And now I can do everything I want to do. If I want to, teach yoga, which I'm doing, I'm teaching again, doing all the exercises that I did before. I refer everybody I know to not only this practice, but Dr. Carlson specifically, because he's not going to come in and start joking around with you right off the bat, but once you get to know him and seeing him for so many years over the time, he is such a caring and trusting individual. He is honest with you. If you don't need surgery or you don't need a medication, he will be there to tell you, and that's a good thing, especially nowadays. I just love that he was very open to questions. He helped me make the decision, and again, going back to what I was saying, with him saying, "You'll tell me when you're ready to have the surgery." there are many doctors out there. I've had friends, acquaintances that, somebody, a physician will be, a surgeon will be just very quick to operate and things don't go right a lot of times when that happens. So I appreciated that in him. I appreciated his patience with me and giving me that chance to go through the steps before we jumped right into it. But he's amazing. He's a great guy. Like I said, I refer absolutely everybody, whether they live here or not, to see him with any spine issues. Emotionally, it was after surgery and after I got home and I started feeling better, started going off the pain medicine. It was like I had a new start on life. It really, really was. And I didn't even feel that way with my neck surgery. This was so much more major. It was, I'm getting goosebumps right now because I just felt like I have another chance to be good again, to be healthy again, and when you're in pain for so long, you get used to it. And I know probably many people that will listen to this will feel the same way. You just get used to not being normal. That's your new normal. And to know that you can be a true normal again and bring yourself back, I think is really important to keep in mind when you're considering surgery or any treatment. There is light at the end of the tunnel, but you do have to work for it.